Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about prostatectomy. What is prostatectomy? Prostatectomy is the surgical removal of the part of the prostate gland or the entire prostate gland. Prostate gland is situated in male pelvis below urinary bladder. Function of the prostate gland is to produce seminal fluid, which is a component of semen. It also plays roles in hormone production and it regulates the flow of urine. Why prostatectomy needs to be performed, or what are the indications of prostatectomy? Any benign condition that causes retention of urine. Some other methods may be done, but if they are unsuccessful, the surgeon will decide to do prostatectomy because there is this retention of urine that may be due to enlarged prostate gland, although the prostate gland is not cancerous. Another indication of prostatectomy is the cancer of the prostate gland or any type of cancer in the pelvic area. The surgeon may have to do prostatectomy. What are the types of prostatectomy? The first one is simple or subtotal prostatectomy. On subtotal prostatectomy, the surgeon will remove part of the prostate gland. This type of prostatectomy is done for those conditions that are not cancerous or is done for the benign conditions. The second type is radical prostatectomy. On radical prostatectomy, the surgeon will remove the entire prostate gland as well as the surrounding structures, and the lymph nodes will be removed as well. This type of prostatectomy is done for cancer of the prostate or any type of cancer in the pelvic area. How prostatectomy is performed. There are different methods of doing prostatectomy. The first one is the open prostatectomy, where the surgeon will make an incision on the lower abdomen. It's usually a big incision, and they will go down and they will remove the prostate gland. Another type is laparoscopic prostatectomy. In laparoscopic prostatectomy, small incision will be made in the abdomen and the laparoscopic instruments will be used while removing the prostate gland. And another method of prostatectomy is the robot-assisted laparoscopic prostatectomy. On this type on this method, the laparoscopic incision will be done and the surgeon will also use a robot to assist while removing the prostate gland. A prostatectomy is the major operation. Therefore, before surgery, patient will be explained about the operation, how to prepare, and what to expect post-surgery. Some patients will be admitted in the hospital a day before surgery so that all the tests will be done. because in most cases, this operation is done for elderly people. Therefore, before the patient goes to theater, all the tests must be done and the patient must be fit for surgery. Once the patient is taken to operating theater, it depends on the condition of the patient. The patient can be done under general anesthesia, or the patient can be done under local, where they will give epidural. It all depends on the patient's condition. Post-surgery, the patient will be taken to recovery room and be taken to the ward, and the patient needs to be monitored closely, especially if the patient had an open surgery, because there may be some drains that needs to be monitored, and there will be a urinary catheter that needs to be monitored. And once the patient is ready to be discharged, it's important for the patient to know exactly what to do even at home, because some of the patient may be discharged with a urinary catheter. The patient must know how to take care of that urinary catheter at home. Another important thing, patient needs to be informed that he has to follow up in the hospital immediately post-surgery, so that everything will be checked after the operation is performed. And the patient must also be advised what are the things that he needs to report into the hospital immediately, even if the patient is at home, so that all those problems will be sorted before any major complications. It is important for the patient to be prepared mentally, psychologically, and physically, so that the patient will be able to cooperate for the success of the operation. And at home, it depends what time of operation was performed. Some patients may not return to work immediately. Some of them will be given 6 weeks, and some of them will be given more than that, depending what type of work is doing. It all that is taken into consideration, because if somebody is doing a strenuous job, it's not easy for that person to go to work immediately. Therefore, the surgeon may even decide to give something like 8 weeks. It all depends. But what is important here, the patient must know, and the patient must be educated about all the things that can happen post-operatively. For today, we will end up here. If you do like these short videos, please subscribe, please share, and comment. Thank you for watching. Till next time, stay safe and take care of your health.